Hello and welcome back. In chapter 6, we're discussing anxiety disorders, right? So these are going to be considered the most common disorders that we deal with. Again, anxiety can stem from stressors that we have, from worries that we have, right? The practitioner distinguishes whether or not anxiety is a normal response to something going on in a person's life, or if anxiety is excessive or out of proportion, because we're all going to have anxiety. All human beings have anxiety, but the level of it, if it's causing the levels of dysfunction, it can get to a point where it can meet the level for a disorder. So anxiety is a mood state wherein the person anticipates future danger or misfortune with apprehension. It becomes problematic when it begins to significantly interfere with the demands of daily living. So again, we're talking about those levels of it and the levels of the dysfunction anxiety can cause. So the first disorder in this section we're going to discuss is separation anxiety. This is characterized by an extreme fear and significant distress about being away from home and family to the extent that it affects a child's ability to function socially and academically. The child's anxiety or fear must cause distress or affect social and academic functioning. It lasts a minimum of 4 weeks for children and adolescents and 6 months for more in adults. Worries that some unpredicted event may happen which will lead to a permanent separation. Some may even have repeated nightmares or scary dreams about separation and can complain about some somatic issues like headaches or stomach aches. Selective mutism. This is formerly known as elective mutism. It's a rare disorder characterized by a child's inability to speak during certain activity where they're expected to speak. The pattern is serious enough to interfere with school or social communication, lasting for at least 1 month, but not limited to the first month of school. The inability to speak is not due to a lack of knowledge or discomfort with the language required in a social situation. The next form of anxiety we're going to talk about disorder is specific phobias. This is seen as a persistent, unreasonable, or irrational fear of a specific object, dogs or cats, or situations that causes intense distress. There are four specific specified phobias: animal phobia, excessive or unreasonable fear of animals or insects; natural environmental phobia. At a very early age, some children can develop fears of situations or events occurring in nature, like storms or water or heights. Blood injection injury involves the fear of needles, invasive medical procedures. And situational phobia, difficulty using public transportation like buses, cars, Ubers, airplanes, and being in enclosed spaces such as elevators. Social anxiety disorder. This is the next disorder we're going to talk about in this section. It's also known as sociophobia, commonly referred to as the performance anxiety, a condition in which a person fears performing publicly, lest he or she becomes revealed as inept, foolish, or inadequate, thereby suffering disgrace, humiliation, or embarrassment. The fear of speaking in public is considered the most common form of social anxiety disorder. The fears are baseless and illogical, but nevertheless, the person becomes severely anxious. Panic disorder is the next disorder we're going to discuss. The DSM-5 differentiates the diagnosis of panic disorder from agoraphobia. The defining feature of panic disorder is recurrent and unexpected panic attacks that last for a very short time, usually within minutes, accompanied by intense fear or discomfort. There are culturally specific symptoms that we need to look at, such as uncontrollable screaming or crying seen in certain situations or whatnot. They're not considered. There is a panic attack specifier. The DSM-5 presents a symptom picture for panic attack to help the practitioners to accurately determine where someone is having a panic attack. A panic attack can accompany other disorders like depressive disorders, PTSD, or substance use disorders. Here are the symptoms for panic disorder. Frequency of the panic disorder varies between ranges from 1 week to interviews of over many years, with four or more of the following: palpitations or heart pounding, sweating, trembling, sensations of shortness of breath, feelings of choking, chest pains or discomfort, nausea and abdominal stress, feeling dizzy, unsteady, lightheaded, or faint, chills or heat, paresthesia, demoralization, fear of going crazy, or fear of dying. Agoraphobia is our next disorder we're going to discuss, right? So different agoraphobic situations, such as using public transportation, being in open spaces, or being in enclosed spaces, or being in any type of crowd, or even being outside of a home alone, always provoke feelings of fear of anxiety for the person that are out of proportion to the actual dangers. and they last for at least 6 months or more. They must always provoke feelings of fear and anxiety for the person that are out of proportion of the actual dangers posed, lasting for at least 6 months or more. As the person begins to take steps to avoid the agoraphobia situation, these serve to cause significant social or interpersonal distress or dysfunction in daily life. Generalized anxiety disorder, probably the biggest disorder in this section. GAD, called it GAD. The anxiety that individuals with GAD suffer pervades his or her entire life and significantly interferes with all aspects of life functioning. The anxiety and worry focus on minor everyday events as well as major life events, more days than not for at least 6 months. Remember, you have to justify that duration criteria. These worries are associated with 3 or more of the following 6 symptoms: feeling restless or keyed up, being easily fatigued, difficulties concentrating on one, mind goes blank, irritability, muscle tension, sleep disturbance, and other anxiety disorders as we close up the chapter. Substance and medication induced anxiety disorders. When considering the diagnosis, it is important to make sure that anxiety is not there due to alcohol, drugs, or some kind of medication. Anxiety disorders due to another medical condition. Make sure there's no medical condition that's causing individuals to have anxiety or the etiology of client's anxiety, or other specified anxiety disorders. This is reserved when the client doesn't meet the full criteria for the anxiety disorder, right? And the practitioner chooses not to document why, or that's for unspecified anxiety disorder. That's when we choose not to specify why they don't meet the criteria or there's not enough information. Now, from the DSM-4 to the DSM-5, separation anxiety and selective mutism have been classified as anxiety disorders. For the different forms of phobias and anxiety disorders, the requirement for the person must recognize that the fear or anxiety are excessive or unreasonable. That has been removed. The specific type of phobias became specifiers but have not otherwise changed in the DSM from DSM-4. The general specifiers for a social anxiety disorder have changed in favor for the performance of only specifier. Panic disorder and agoraphobia are now 2 separate disorders, and panic attack is listed as a specifier for all DSM-5 anxiety disorders.